Welcome to everyone. Today, we are here again with our national series of conversations that relate to clean air, climate, health equity, and inequity. And today we are focusing on protecting Latino families from extreme heat, protegiendo a las familias latinas del calor extremo. And although my Spanish is not very good, I'm tried to say that in Spanish because I wanted to emphasize that today's session is going to be recorded in English and also be available in Spanish translation, because one of our goals is to make sure that these conversations are as accessible as possible to our intended audience. So with that, I'd also like to just acknowledge that today's program is also being co-hosted by EcoMadres. EcoMadres is a part of Moms Clean Air Force, and Moms Clean Air Force is a national organization of about 1 million moms and dads and caregivers who are deeply concerned about clean air and protecting children's health. EcoMadres, which also is sharing kind of the same goals as Moms Clean Air Force, also is focused on educating and empowering its members to use their voices to reach lawmakers and elected officials to demand equitable solutions that protect children's health. EcoMadres is led by its program manager, Carolina Pina. Today, we're going to be talking about extreme heat and its direct health impacts. And some of those important impacts are on your screen. Extreme heat affects and causes heat-related illnesses. Air pollution also makes the problems with health even more intense. There are mental health impacts, adverse birth outcomes, and unfortunately, we find that there are increased hospitalizations and even death. There are also some food safety issues as well. And these are just some of the issues that are related to extreme heat. And in our discussion today, we're also going to be talking about who is vulnerable to these impacts. Pregnant women, older people, and that's generally considered to be individuals who are 65 and older, people with underlying medical conditions such as heart disease and respiratory illnesses, people taking medication that makes them more sensitive to heat, athletes and others who are outdoors for considerable periods of time, outdoor workers such as first responders, farm workers, street vendors, landscapers, and construction workers are often affected by extreme heat. And also, it's also a great concern for those in low wealth income communities who may have limited access to air-conditioned spaces and healthcare if needed. Again, this program today is a part of Moms Clean Air Force's national series of panels focused on clean air, climate, health equity, and inequity. And if you would like to have additional information, please go to our website at momscleanairforce.org and look under the heading Health Equity Panels. Now, what I would like to do is to introduce you to our panel members. I'm extremely honored today to have with us Dr. Untitled Chapter, Dr. Teresa Munoz, and Ms. Karine Stein. Dr. Untitled is a scientist and social scientist who's with the Union of Concerned Scientists. Dr. Munoz is an obstetrician and gynecologist and also a physician member of Climate Health Now. And Karine Stein is a member of Moms Clean Air Force. She's also a member of EcoMadres. And in addition to being the field coordinator in Iowa, she is herself a mom. And what we're going to do in today's conversation is start off briefly and give each of our panelists an opportunity to share with our audience what causes their passion around these issues and why it's important to understand how extreme heat is affecting Latino families. So I would like to start first with Dr. Munoz to have her share with us in just about 4 or 5 minutes what caused you to have your passion about this subject matter?
Well, so in particular about heat, it was my son, Theo, who loves to play ultimate frisbee. And in fact, that's the only sport he was willing to play. And I realized that that was very good for his physical and mental health. And as we had more and more hot days, we had more days where he couldn't go out and play. And so the alternative really was to stay indoors with the windows shut. And, like many other teens, his first choice at home is to play video games. So that's what he did instead. I also take care of pregnant patients, most of them Latinas. And I understand that they're vulnerable to extreme heat. And then in general, climate change, I know, will affect everybody's health. And as a healthcare provider, I think that I am not doing a complete job if I don't address climate change and join in the fight to mitigate some of these changes. Going back to my family, as I said, is one of my motivations. And he was born before I knew as much as I know about climate change and health now. But I chose to have a second child with this knowledge that, the future of children is not going to be like my childhood was. And so it's my duty, having made that choice, to do what I can, again, to mitigate the effects of climate change.
Great. Thank you, Dr. Munoz. Dr. DeClat-Barato, could you also share with us some of the reasons why you have a passion for this work?
Absolutely. Well, I think, I have had a long-standing interest in redressing inequitable impacts and vulnerability. I am from Puerto Rico, a U.S. territory that has been recently ravaged by climate change, by a terrible back-to-back hurricanes that destroyed the island. I lived in Phoenix for a long time, where I trained, and I have seen the progress of climate change and extreme heat on the communities. I had opportunities to work with those communities in finding solutions, in documenting and analyzing and researching the unequal impacts of climate change on environmental hazards and environmental disamenities writ large on communities of color and low-income communities, and that has provided me with the knowledge and the conviction that we need to address these. That we need to use, those of us who have the privilege of going to college and obtaining an advanced degree, to have learned from many of these impacts in the classroom, but also in the neighborhoods, in the places that I have lived in, that I grew up in. We have a responsibility to raise our voices, to bring our talents, to bring our skills, to bring our experiences to this fight to curb climate change, and to do it together with the communities that are most impacted by them.
Thank you. Ms. Stein, would you share with us, you're a field coordinator for Moms Clean Air Force, so we know a bit about the fact that you have a dedication to this work, but could you share from your personal perspective what brought you to be involved?
Yes, thank you so much. So in addition to all the things I've learned as EcoMadres coordinator in the state of Iowa, and as a Moms Clean Air Force coordinator also in Iowa, but I do a lot of work nationwide with other colleagues. In addition to that, my personal experiences span 3 regions in the Americas. I'm a Colombian citizen, and I grew up on a farm in Eastern Colombia. Then when I was 12, my family moved to Costa Rica, and my family has been doing conservation work there in the rainforest area ever since. And then about 40 years ago, I came to Iowa on a student scholarship, thought I'd stay 4 years and return, but met my husband, and here I am with grown children now. And my story in Iowa plays out in one location in rural Iowa over the last 35 years. So what I see as far as climate change and heat plays out in my life simultaneously in 3 parts of the world. Because I go to Colombia, I still have family, I see what goes on. As a farm girl, I see how it plays out and how it becomes more and more difficult to farm there. The environmental work that I do in Costa Rica has shown me how difficult it is to carry some of that work because of shifting parameters caused by climate change. And then in Iowa, needless to say, I see it all around me, being in rural Iowa, shielded from artificially maintained ecosystems. We don't have air conditioning in our home. That is by choice. The house was built that way, and my husband and I decided we don't really need it. We run a whole house fan at night. Well, we're rethinking that, because what's happening in our home in the last 10 years has become unpleasant, difficult. I'm developing not asthma, but I'm developing breathing difficulties at night. I have an underlying heart condition. So in a way, I'm kind of a canary in the coal mine. And I observe myself and I see what's happening to me. We've had, I think the whole country heard about the derecho storm we had 2 years ago, which is a violent straight line wind that in my neighborhood destroyed 200 trees in half an hour. And I had seen the derechos before in 10-year, 15-year increment. The distance was a decade at least. Well, we just had another derecho 2 years later, very close to here. And I see what happens to my Latino community. I'm a touring musician. And so I go to many communities in and outside Iowa. And I come in contact with a large diversity of people of all socioeconomic backgrounds. And I hear their stories. So as time goes forward, I become more and more passionate, not just because I see it wherever I have connections, but because I also feel it in my body. And the last part is I have 3 grown daughters, and all 3 are so concerned about what's happening with the climate that all 3 might decide. 2 of them have already decided. The 3rd one is thinking about it, not to have children, because they don't want to bring children into this world like that, which only redoubles my commitment, because there are children already here and they need our action now.
Thank you so much for those words. At Moms Clean Air Force, we're keenly aware of the disproportionate impact on communities of color, Black and Brown communities, and low wealth income communities in terms of how just in general climate change is affecting these communities. And because often what you find is that the individuals in the communities are living closer to plants, they're living closer to high traffic areas, and all of these factors impact on the quality of the air that we can breathe. I want to turn for a moment to you, Dr. Munoz, because I'm very curious that as a physician who specializes in women's health and pregnancy, and particularly you're an obstetrician and gynecologist, tell us something about your patient population. You mentioned that you do have a large number of Latinas in your population. Are there any aspects to having this particular group of patients that impacts how you see the impacts on them of heat, weather in the areas where you're practicing?
Yeah, most of my patients work indoors, so they're not exposed to heat outdoors for a large portion of the day. But here in the Bay Area, most of our homes are also built without air conditioning because we never really needed them. Also, most of my patients are of low income, and so their homes overall don't have good indoor air quality. So I know that is worsened by the high heat. Homes in the Bay Area can get really hot towards the end of the afternoons if we have a hot day. And so pregnant bodies are already working much harder, right? We have a higher amount of blood in our system. We have this baby that we're growing. And so to add to that, the work of cooling it down can be, it's an extra burden for the body. And so we do see moms who come into the emergency room dehydrated from overexposure to heat. We also know that when pregnant patients become overheated, there can be some effects on the fetus. So there is a body of evidence that suggests that, fetuses can be born with spinal defects, for example. And we ask moms in their first trimester to really avoid heat. Things even like hot tubs or taking really hot showers, because we want to try to avoid these teratogenic effects or birth defects in children. And so I would say, here in the Bay Area, my patients are mostly affected when we have really warm days, which we are having more warm days, and from being in homes that have poor insulation.
When I hear that, it makes me think out some of the things that you were saying earlier, Ms. Stein, and kind of leads into, follows rather, what Dr. Munoz was saying. When you talk in your role as a field coordinator and you talk with Latino families, what are you hearing from them about their experiences?
Well, I interact with Latino families in Iowa on two levels. Basically, people who have small children. And one of a close Latina friend of mine works in a public health clinic here in Des Moines, which is about an hour away. And she has just informally observed a very strong increase in childhood asthma cases, emergency cases that come in. She works in an emergency clinic. And I just pulled up an article from where a scientist from the National Institutes of Health is quoted. And the first line reads, about 1 in 10 Iowans has asthma and that is a rate that's a little higher than most other states. So there is national confirmation of what my friend sees informally in the clinic over the 10 years that she's worked there. So one source of information are the moms that I interact with. And the other source of information, because of my music activities, I spend a lot of time going to various communities. I don't tour much outside of the state right now because of pandemic reasons. Mm-hmm. So I'm accepting more gigs at festivals in Iowa. And at these festivals, I see a broad range of people, some middle-class professionals, but also a lot of working-class Latinos. And where are they working in rural Iowa? They're working on farms. They're working on road construction. Those are the two types of communities that I mostly interact with. And what I hear from them is it is becoming unbearable to work outdoors. I also happen to have a daughter who is a veterinarian, and she says it's just very difficult to on these hot days, which have become clearly more numerous, to work outside when you're exerting yourself. And I, as a musician, I just had a performance 2 days ago, and I'm still recovering from it because of this underlying heart condition I have. I was on my feet for 2.5 hours performing. Well, that was a piece of cake 4 years ago. My heart condition hasn't gotten that much worse. So what's the changing variable here? It is the extreme heat, but there's another component in Iowa. If you look at the map and you understand something about the currents of air movement in the United States, you will see that Iowa and central Midwestern states are squarely in the path of the Gulf Stream. The Gulf Stream comes from the Texas Gulf, and it goes north. And what happens is that our heat gets pumped with an enormous amount of humidity. Right now, it's 97% humid out there on a sunny day. What happens when you have such high humidity levels? Our natural way of air conditioning our bodies, which is to sweat, no longer works because the humid air no longer allows the sweat to dry off. It sticks to our bodies. And so outdoor workers that I talk to are stuck in this highly humid and, of course, hotter environment. And that is simply plainly dangerous to human health.
When you mention outdoor workers, I just to clarify for our audience, are you talking mainly about farm workers, or are you also talking about others like maybe construction workers or street vendors?
I don't see that many street vendors here because in rural areas, but road construction is a big one. I mean, ironically, with bipartisan infrastructure money coming in, Iowa is seeing a lot of increase in road improvement. And I see these people standing on the hot roads. I've got my air conditioning on in my car, and they're out there, and I talk to them because often you're stopped, right? And so you talk to them because I hear them speak Spanish. I lower my window, say hi. I offer them some water often. I always have extra water in the car. And the construction is a big one. And farm work, yes, absolutely. There are also, we have indoor workers. A lot of them are Latinos and Latinas in the meat processing plants. Now, the meat processing plants have, for the most part, have reasonably good air conditioning, but then we went through this whole other issue during the pandemic, and it still is going on. The pandemic is not over. And these workers are often exposed to conditions that make them particularly prone to becoming ill with COVID. And then they go home to multi-generational homes, and they may or may not have the money to run their air conditionings. And what kind of filtering systems do they have at home? They stay at home because outside it's too hot. The kids come home, they stay indoors. That's another complaint I hear from moms. My kids spend all this time indoors because they say it's too hot. Well, it is too hot. So yes, and yes. We see construction workers on road construction, particularly farm workers, and then also meat packing plant workers who develop issues for different reasons.
Thank you, Ms. Stein. And Dr. De Cleparetto, as a dad and as a scientist, and you focus on climate and vulnerable populations, how do you explain to your children what you do?
Well, Amira, I have two girls, Sofia, who's 9, and Amaya, who's 5. At their age, unfair, as in that's not fair, is a phrase that's it's thrown around a lot, an inordinate amount of times. So I try to use that to sharpen their sense of fairness away from the individual notion they have to a sort of collective one. I tell them that the inequitable impacts of the climate crisis are unfair, that have been caused by a few selfish people that historically have prioritized making money for themselves over the health and lives of the majority of people in the world. I tell them it's important to fight for climate action in a more just world. And the reason that this is important is that those of us, again, with the privilege to live in a clean environment, in a clean and safe environment, in good health, with food on the table, going to a good school, etc., we have a responsibility to enable others to have access to a healthy and fruitful life. And also, quite simply, if we are not all together in the fight against climate change, then none of us is going to succeed. The scope of this problem is so large, it's so big, that it's an all hands on board sort of thing.
Thank you. I want to turn back to you, Dr. Munoz. And one of the things I was wondering is that we know from our personal experience that people who go from an air-conditioned car to an air-conditioned house or air-conditioned work setting have minimal complaints about, the extreme heat. But in terms of, and I know you mentioned that many of your patients are indoor workers versus outdoor workers, but in your capacity as a physician, what are you hearing about the impact of people, of particularly women, who are outdoor workers, either as farm workers or street vendors? I mean, for example, I've seen some statistics that say in Los Angeles, 80% of the street vendors are women, and many of them are Latina. Or I've also read that there's been a huge feminization of the farm labor market, so that now there are many more women and especially pregnant women who are working outdoors and how that impacts them. I wonder if you could offer any comments about those kinds of situations.
So when we are exposed to extreme heat outdoors, again, our body needs to work harder to cool itself. So we are more likely to become dehydrated and get dizzy and sometimes even faint, right? So both men and women are vulnerable to this. Pregnant women, as I mentioned before, their bodies are already working harder. Their blood volume is higher. Their heart is already beating faster than usual. And so they're more likely to become dehydrated. They can get heat exhaustion, heat stroke, and end up in the hospital much more easily than other populations.
Ms. Stein, as you mentioned that you're in Iowa and you are in a rural setting, but I imagine in your capacities with EcoMadres and with Moms Clean Air Force, you do get to talk to people all around the state of Iowa. But as Iowans are experiencing hotter temperatures, one of the known effects is an increase in tick-borne diseases. And I wonder if you are hearing from those you encounter if they are experiencing any issues regarding tick-borne disease and other types of pests that have been associated with increased temperatures.
Well, yes, both on a personal level, because I explore nature, I haven't experienced tick-borne diseases, but I can tell you that going out, then when you come back, requires very thorough inspection, and that was not the case 10, 15, 20 years ago. I see that some of the workers who are not so much in road construction, but farm workers are more susceptible to tick-borne diseases. And I have known several people who have experienced those. And the problem is people aren't thinking in those terms yet. So they experience fevers and chills, and then they go and take a COVID test, and that's not it. So then they go on this wild goose chase on what's going on until they end up in a university hospital where researchers look, the general practitioners may not be thinking about that. And so meanwhile, 2 months go by and this person is experiencing recurrent symptoms until finally they end up with a specialist who says, let's check you for tick-borne diseases, like Lyme disease. That's the famous one, but there are others. And for example, a close friend of mine last week almost died of ehrlichiosis, which is a tick-borne disease. And he too thought at first, oh my goodness, I caught COVID, and just went home and took care of himself, and that was not it. So tick-borne diseases, and that's the big one for us, but we also see insect pests increasing that are affecting the natural environment and farming. Right now, we have the beginning of an infestation of earthworms that are not native, and they're just taking off because of the increased heat and humidity as certain species, and it's beginning to destroy crops. Other states have already experienced this. The ash borer, basically all ash trees in Iowa are dead. And it's just one of many things. So it's not just humans that get affected directly, but also our crops, our ecosystems. And the other thing is, I mentioned earlier, my husband and I don't have air conditioning in the house, and we thought we can get by. We just regulate it by using a whole house fan and cooling off the house at night. And that worked for us, and it's not working anymore because the nights are staying hotter and more humid. Well, I mentioned also earlier that I personally, for the first time in my life, am experiencing, when we pull the air through at night, allergy symptoms. So that's another way in which we see an explosion in hot, humid Iowa of undesirable crops that get favored disproportionately by this climate change. And it sends people to the hospital because they're experiencing allergy and the asthma for the first time that they had never experienced before. So health is affected at a variety of levels, not just human health, but also farming health and the health of the natural environment.
You know, that leads me to ask you a question, Dr. DeClette Barreto. What as you do your research and you hear the examples that Ms. Stein is giving, do you have thoughts about what is the most effective response for Latino families to respond to these increased risks?
Well, yes. I mean, I think of all the things that Karin is mentioning, and it makes me think that all of these are linked to climate, and that there are very different ways in which Latino communities are being impacted. Some of the ways in which communities can fight against these impacts is there's through community engagement, for example. There's a need for cities, for states, for the federal government, for governance and government agencies at all levels to engage with communities, because the communities understand their problems. Karin has a lot of knowledge about the issues and the problems that are linked to climate change, how they're interconnected between health and housing and jobs and so on, and the socioeconomic sort of picture of populations that limits or enhances their ability to fight climate change. She mentioned middle-class folks. She mentioned farm workers who have very different sort of socio-demographic, socioeconomic profiles, and hence different abilities and resources, economic resources, social resources to be able to cope. And so that is a key way there's a lot of knowledge in the communities themselves. We need to be able to broaden the definition of experts that needs to go beyond people with advanced degrees, such as myself. Communities have expertise in their neighborhoods. They've lived there. They understand their problems. They know their communities. They know what the roadblocks are, and they know the opportunities for action. And so that sort of collaboration is very, very important between policymakers and scientists and community members and intergenerational communities that have long-standing knowledge of their neighborhoods.
Thank you. That makes me think of a question for you, Dr. Munoz. When your patients come to visit you, are they asking you questions, or are they, if to the extent they're asking you questions, how do they express the connection between either how heat is impacting them or how these changes in temperature and poor air quality, how do they express that? Or do they ask you directly? Do they say, like, I've been following the increased temperatures and climate change, and how does that impact me as a patient? Or how does that conversation occur?
Yeah, so many women have noticed just the hotter days, right? Mm-hmm. And so they'll ask, for example, is it okay that I exercise, that I go out for my walks if it's a hot day? Or they'll say how they just feel tired at work, right? And they feel like they need more breaks, or they're just hot and they don't necessarily have the time to go grab a drink of water. And so they ask questions related to that, whether or not that's going to affect their pregnancy, because it's particularly the pregnant women, right, that have lots of concerns about their environment and how it's affecting their pregnancy. So that's their primary concern. Other patients, some patients come in with some knowledge about climate change and heat-related illnesses and ask, particularly because they're concerned about their children, right, and what their effects of increased heat and climate change will be on their children. And we have a conversation about it. But I have to say that most of my patients don't ask about climate and how it affects them. And, they're working class women who have concerns about paying their rent, particularly here in the Bay Area. There's a lot of housing instability. And so they just have other pressing concerns. And so they don't have the time to really think and digest, these concerns about climate change and really link them to their health.
You mentioned about your patients. What about your colleagues? One of the things that I have read about is that there is not yet a comprehensive strategy in residency training or medical schools about climate, but when you talk with your colleagues, what type of response do you get from them? I know you're active in the health professions group in California, Climate Health Now. When you talk with your colleagues, what do you hear from them?
Really a variety of responses. There's some of my colleagues are not ready to take on that challenge because they feel overwhelmed, right? Mm-hmm. Like the issue is so big that they just are not sure where to start. And the other thing is, like, especially now, doctors are overworked, right? So they're not necessarily focused on climate because they have so much just patient care to do. And then in terms of health education, we definitely have a lot of work to do. There's lots of gaps in health education. Even when you don't consider climate change, right? We should know a lot more about nutrition and exercise and sleep. And we definitely need to start learning more about climate. Of those colleagues who are active, a lot of us know that we need to start engaging to some degree in politics, right? And talk to our elected officials and push for them to really be leaders in the community and to have the benefit and the welfare of the community as their primary concern, and that it's important that they recognize that politicians recognize that climate change is impacting every one of us and that we can't ignore it, right? We need to start making policies that are going to improve or decrease the amount of greenhouse gases, for example, and in order for us to have a better quality of life.
Thank you for that, Dr. Munoz. I would like to come back to you for a moment, Dr. De Cleparetto. We just talked a bit about what physician or health professional colleagues are doing. And from your field and from your vantage point, since you are a member of the Union of Concerned Scientists, there may be members of our audience who are not familiar with your organization. Can you share with us what you do and how your work or the work of your colleagues is impacting this important discussion?
Thank you. The Union of Concerned Scientists is a national scientific advocacy organization, and we work to make sure that science is used to enact policies that are conducive to a healthy population and a healthy planet and a safe planet. And so we do that by working across different issue areas that have to do with food and environment, democratic rights, climate change, and energy, which the climate change program is the one that I work in, clean transportation and safety in nuclear weapons development and policy. The way then that we apply the sciences is that we use it to elevate it and make sure that it makes its way into policies at the federal, state, and local levels. And we work with a social and racial equity lens to make sure that those policies are scientifically sound and also racially equitable, so that they benefit the communities that have been most impacted and most harmed by climate change to help redress historical and current inequities.
Thank you. Thank you for sharing that. I wanted to come back to you, Ms. Stein, because we've talked a bit about the experiences of rural Iowans. You've mentioned that you're talking with people all across the state and indeed some people across the country. In terms of the work that you've been engaged in, do you have an experience that you could share that would say what you think has been the most effective dialogue that you've had to make people aware that there is a connection between health and extreme heat or any type of climate change impacts?
Well, I think it's pretty natural for Latinos and Latinas to perceive that connection. In fact, if you look at the statistics, Latinos and Latinas nationwide are more concerned about climate change than a lot of other cultural groups. So it's a natural conversation to have. The problem is something that both Dr. Munoz and Dr. Beckett Barreto have talked about are socioeconomic factors that limit what people feel they can do. That is really the barrier, not making the connection. So let me just talk a little bit about the people that I know personally and my own upbringing of my children. The people I know personally, because of the music, I interact with a broad spectrum of Latinos and Latinas. My social circus, my social circle is not just professionals like myself. In fact, I would say I spent most time with Latinos and Latinas who do not have a college education. And that's natural to me because that is how I grew up, on a farm, among people who were very tied to nature. The immigrants in Iowa are here mostly trying to provide a better future for their children. That means they also are often overworked. That means they don't have as much time for their children as they might have had back home. It also means they are disconnected from their normal social network. So what happens? The kids can't just go over to grandma or to cousin Cecilia. They stay indoors while their parents work. And in safe areas like rural Iowa, they can go outdoors and play, but oftentimes they don't because of the heat or because it's just more comfortable. Teens really tend to drift towards the tablet, the screen. And so that becomes a catch-22. The parents don't have the social networks that give them more time and fewer worries while they're away from their children. Their children spend more time on the tablets. The parents come home overworked. They just want to stay home where it's cool. And little by little, the Latinos and Latinas who back in Latin America would have had more connections to family and also more connections to nature, spent more times indoors. That means their children are now growing up with a disconnect of simple, straightforward knowledge. They are not noticing that there is an increase in mold production in their basement because it's a new home. And grandma says, wait a minute, that mold is a new thing. That's what's happening in my house. I'm seeing mold in my house. I've lived in the same house for 35 years. I see the continuity. A lot of the Latino and Latina families have lost continuity in their social context. And that in itself becomes a barrier to acting aside from just the survival race. So my biggest joy is when I can get together with Latino and Latina families who are just struggling to make it for their children's future, give them hope that through, for example, an organization like EcoMadres, they can make a difference. And my biggest moment of pride is when I can get one of those overworked moms or dads to come with me, either virtually or in person, to a meeting with a legislator. And they can just say, look, my kid has asthma. She didn't have asthma when we lived elsewhere. Those stories remind our legislators that the statistics are made of human realities.
Similar to what Ms. Stein was just talking about, Dr. Barreto, what is the most frequent question that you hear about how heat is affecting vulnerable Latino communities?
Well, I very often get asked by Spanish media to list individual things people can do to fight climate change, to protect themselves from extreme heat. Mm-hmm. And I think that while it's important to, of course, stay hydrated, to check on your elders, to make sure your kids and, workers have shade, to recycle, to buy LEDs, to use transit, reduce activities that burn fossil fuel, etc. The scope of the climate crisis is such that individual action is plainly not enough, that we need large-scale action to reduce emissions to curb climate change. So that we, for better or worse, and for as much disillusionment and frustration people may have with the current state of affairs and with the limited ability or capacity or willingness of government at all scales to do something about the climate crisis, well, though the people who can vote voted for them and put them. in power for a reason, and they are accountable. They are accountable to people. The people who cannot vote and can exercise their power in a different way, for example, through either direct action or even as a consumer, right? We have quite a bit of power as consumers to demand different products, to the products that are made in a more sustainable way, for example, to demand both mitigation and adaptation to the climate crisis. Mitigation meaning the reduction of emissions that are warming the planet, moving us away from fossil fuels in our economy, in all sectors, in transportation, in energy production, which are the largest sectors in terms of emissions, and also adaptation, which means to take the measures and do the things that need to be done to protect people from the climate impacts and the level of warming that we cannot avoid. Because there is a level of warming that is unavoidable, because those emissions that are already out there, trapped in the atmosphere, are going to remain there for a while and will continue to heat the planet. Those are things that are needed and that often don't get as much play. The collective action, the large scale action that needs to happen so that fossil fuel companies are held accountable for their activities and the things that they have done, which are the largest contributor to the climate change problem.
May I add something to that?
Yes.
So obviously, we need to address the big players in this, but the beauty of the work that I do for EcoMadres is that those communities that I refer to that are disconnected from their extended networks of families that they left behind when they came to this country. One of the things that we do through Cafecitos is Cafecitos are community gatherings where EcoMadres present climate change issues, is to bring Latinos and non-Latinos of a community together. And so we help them build community in a new and strange place. And little things can make a big difference. For example, what you were referring to just now is right now I'm looking to work with a Latino organization on writing a grant, a social justice grant, an environmental justice grant provided by Google. It's fairly simple to apply to, and our hope is to buy air monitors to place in communities where we were seeing Latinos have breathing issues and mysterious health issues. Because when you look on the website of the national, la Asociación Pulmonar, ¿cómo es que se llama? Some Spanish speakers help me out here. The National Lung Association.
Yeah, the American Lung Association, right? Quality.
You look in Iowa, and most Iowa counties don't reflect air problems. Well, I know otherwise because I see the people on the ground. The reason behind this is we don't have monitors. So, of course, there's no data collection. And so communities can feel emboldened by tools like getting air monitors. I don't get those air monitors, but I get local communities to apply for them. That's one of my goals. And the other thing is to remind them that in addition to talking to our legislators, we have other tools. The EPA still has a lot of regulatory power. And so I invite my Latina and Latino concerned community members to when we present testimonies with the EPA. So there are a lot of ways that Dr. Juan de Clet Barreto just reminded me that Latino communities can be and must be empowered because we are a growing community in this country and our voice is important.
One of the, as a follow-up to what you've just said, one of the things I was just thinking about is that part of the reason why we're having this conversation today is to push out information to the Latino community in particular, but to all people who are concerned about these issues. And it occurred to me, Dr. Munoz, you mentioned that you're bilingual, that you have a significant Latina population among your patients. If you could not communicate to your patients in Spanish, how would they be able to access the healthcare services or to even find out about some of these issues related to heat and other temperature conditions that are affecting their pregnancy? Is there are there limitations on the available information that's in Spanish?
Yeah, there certainly is. The organization that I work for tries to provide information in as many languages as possible, but it isn't enough information for Spanish speakers. And, we actually have a lot more information for Spanish speakers than we have for others. For example, our Nepali speaking patients, like there is no written information for them at all. Oftentimes I will send my patients links to websites that are in English or information in English, and they have their Google Translator and they'll use that.
Well, certainly that is better than not having it translated at all. Yeah. There are some challenges, at least in my limited knowledge, with the auto translation. I mean, not with any auto translation, just because of making those technical changes. But it certainly is good to have some access to that type of information. As we've been talking today, one of the things that I hope has come through our conversation, because each of us who is in participating, we're in different parts of the country. There are different issues, there's similar issues, but there's the Latino community is not one monolithic group, that we have there are very different experiences, but there are these common experiences that we've been talking about today. And one of the, how we came to have this conversation is that as a part of what we do at Moms is to try to find out from our members and our affected communities what are issues that are concerning to them. And this issue of extreme heat was an issue that came right to the top in terms of a concern that people in the community had. So I really appreciate the voices that each of you have been lending to the conversation today to push this information out. What I would like to do now is to give each of you an opportunity, kind of a lightning round, to just close out to say, if you could be king or queen for the day, what would be the one or two things that you would really like to see happen, and actionable or action steps that could be taken that would be helpful to the community to protect them from the problems related to extreme heat? And I'd like to start with you, Dr. Barreto.
Well, I think that this is what comes to mind. What Karin said made me think about it too. I read recently in a 2021 report by the Latino Donor Collaborative that Latino workers account for nearly 3/4 of the total recent expansion in the U.S. workforce as the aging boomer population continues to retire, right, and exit the workforce. Now, today, that's a young workforce. And that's a lot of people who will work outdoors, who will work indoors as well, who will have families to feed, who are going to need healthcare. They're going to need good weatherized and energy efficient homes, access to clean vehicles. How are those people supposed to thrive personally and professionally and contribute to the broader economy if they're not protected from climate impacts and extreme heat in particular, right? So this is just the preamble to say, well, that the solutions that need to be on the table as part of the National Resilience Plan from the federal government, as part of climate adaptation and action plans at the city and state level, of protections for the general population and protections also for the workforce, especially for outdoor workers, they need to consider these things. They need to be able to protect people so that they can thrive as well. It's not just the moral thing. There is an economic grounds to do this. Otherwise, you're not going to have a population that is going to be healthy, that is going to be conducive to a strong national economy.
Thank you. Dr. Munoz?
Yeah, I would say in terms of the general population, I would love everybody to understand just how important they are and how important their health is and how powerful they are, and to demand from our policymakers to provide them with what they need, right? It is the answer to not having enough money to pay your rent isn't to work another job, right? It is to increase wages and to have more housing availability. And so I want everyone to feel like they matter, right? And that their health should be one of their most important priorities, and to demand that the people that we have voted to put in office step up to the plate and really start providing for their communities a healthier way of life.
Thank you. And I'm going to give you the last word, Ms. Stein.
Thank you. It's been an honor to be here on this program. I would like to pick up on something very important that Dr. Munoz addressed, which is the difficulty of getting to information in many cases, and information simply is power. At EcoMadres and Moms Clean Air Force, we really believe in the power of information for the non-scientific person. We provide bilingual, and it's constantly growing, bilingual information and to concerned citizens, but it's not enough just to put out the information. The information needs to reach people through trusted intermediaries. And I'd like to say something in Spanish because this is the basis of trust for the community we are addressing right now. No es suficiente venir a este país y tratar de construir un futuro mejor para nuestros hijos simplemente con medidas económicas y con actividades económicas. Tenemos que velar por el futuro de la salud del planeta para que las generaciones subsiguientes estén protegidas, no solamente económicamente, sino en su supervivencia básica. Y en EcoMadres estamos aquí para ayudarles. Lo hacemos sin que ustedes tengan que cambiar sus estilos de vida. So basically, I would like Latino and Latina families to know we understand their interest, any parent's interest, is to create a better future for their children, but it's not enough to worry about economics. It's fundamentally important to fight together for a safer climate, because that will make economics irrelevant. And we are a trusted organization. We have EcoMadres in various communities. Come to us. You don't need to change your lifestyle to learn more and to be able to do more. And I think that's the basic message that I'd like to leave everyone with.
So I want to thank each of you for your contributions. I want to tell our audience that they can go to momscleanairforce.org to read more about the bios and backgrounds of each of our speakers today. And I also want to encourage anyone who's listening to our program and watching our program, please don't stop here. Become involved with Moms Clean Air Force, become involved with EcoMadres. Reach out to your elected officials and let them know how you feel about these issues. What we are hoping to accomplish is justice in every breath. And please watch out for our future programs, and we will be coming back to you with more programs later this year. So thank you, everyone. Until next time.
Thank you.
Hasta luego.
Well, thank you.
I want clean air and water safe.